Hair loss is a huge problem. Here in the United States, probably nearly 100 million Americans are dealing with a hair loss situation. Hair is a very emotional organ, as we
Mhm.
say here. It can really affect their quality of life because hair is a sign of youth and vitality and, of course, fertility. Today, we know that hair is something that's really, really important for self-confidence. Everything from whole body inflammation to scalp health to your overall nutrition, your sleep-wake cycles, your stress and cortisol levels, the allostatic load, as we say, which is everything that stresses out your body, can influence your hair follicle function.
You're listening to the Visibly Fit Podcast. Hey, I'm your host, Wendie Pett, and every week I'll give you holistic, practical solutions for everyday issues related to nutrition, healing, functional fitness, and behavior modifications. As a naturopath, fitness expert, and wellness coach for over 20 years, my goal is to empower you to reach for greater health and to rise up to your next level of living in mind, body, and spirit. You were created with greatness in mind. It's time to own it. Are you with me? Then let's dive in. Hey there, and welcome to the Visibly Fit Podcast. I'm your host, Wendie Pett. Today, we're going to talk all things hair. That's right, hair. How is your hair? Is it thick and flourishing, or do you feel like it's thinning a little bit? Well, we're going to dive in a little bit as to why maybe that is happening and what you can do about it. This is a podcast where we talk a lot about health and wellness and just different innovative solutions for personal health and personal growth and transformation. So that's why I really wanted to bring on my guest today. And he's such a delight. His name is Dr. Alan J. Bauman, and he is a renowned hair transplant surgeon and the founder of Bauman Medical. You've probably heard his name if you are in the space of trying to solve some hair issues. He is very well known. He's established in Boca Raton, Florida, and he started his practice back in 1997. He has worked with nearly 34,000 patients, and he's treated over 12,000 with hair transplant procedures. He's truly remarkable, and he's made a mark in his field of hair restoration. Now, Dr. Bauman, he's very compassionate, and he is patient-centered in his philosophy. And he really couples his philosophy with his artistic approach to hair restoration, and it sets him apart as a leader in his field. I mean, it truly, truly does. After earning his MD degree from New York Medical College and completing his surgical residency at prestigious institutions like Mount Sinai and Beth Israel Medical Center in Manhattan, he pursued specialized fellowship training in hair transplantation in New York. So among the elite in his profession, Dr. Bauman is one of only of about 200 physicians worldwide that are certified by the American and International Board of Hair Restoration Surgery. He's also a member of the International Alliance of Hair Restoration Surgeons, and his accolades include being voted America's #1 top hair restoration physician, for 8 consecutive years. I mean, 8, not just 1, but 8 years. And he is recognized as the hair restoration surgeon of the decade by Aesthetic Everything. But Dr. Bauman, he's more than just a surgeon, and you're going to hear that on the show. He is an author. He's a philanthropist. He is a business leader, and he founded the Bauman Philanthropic Foundation, which provides pro bono hair restoration treatments to those in need. And he serves as the volunteer medical director for grayteam.org, and they support veterans in their transition to civilian life. He has got such a heart for people. Let me tell you, he is just a wonderful human being. So I hope you'll join me on the show. Even if you don't have issues with your hair, you may know someone who does, and you can forward this episode to them and share baumanmedical.com with them as a possible solution for their own hair restoration. But understanding his philosophy and the way his He just has a holistic approach for his patients. I think you'll be well pleased, and you're going to be enlightened on the whole hair restoration process. So enjoy the conversation with Dr. Alan Bauman. Well, welcome, Dr. Bauman, to the Visibly Fit Podcast. It is so good to see you.
Thanks,
Again.
Wendie. Thanks so much. Yeah, thanks so much for having me.
Yeah, this is great. I actually saw you in person in Boca Raton with my husband. He had an appointment with you, and I just thought, oh my goodness, I have got to get this guy on my podcast. You are just so awesome at your holistic approach, and you look at the person as a full person. You're not just looking at their hair and saying, oh, I can do this surgery and that. You really are looking at the person as from a holistic point of view. And I really appreciate that about you as being a naturopath. So let's talk a little bit about hair, because that's your expertise. How many people really are suffering with hair loss?
Well, hair loss is a huge problem here in the United States. Probably nearly 100 million Americans are dealing with a hair loss situation.
Wow.
You know, the American Academy of Dermatology and many of the places like the American Hair Loss Association say it's probably about 80 million total, but I think it's undercounted because there's so many folks out there, just not hair loss, but also hair color changes, the quality of their hair, the volume of their hair. And so it's a very big issue. Now, there's more men than women that are counted in that number. But in my practice, it's almost straight down the middle, 50-50 men and women who have come to see me over the past nearly 30 years.
Really? Okay. Well, I find that interesting because, yeah, I think we tend to think that more men deal with this rather than women. But I will say that I was just teaching at a health immersion in Florida, and there were two women that were there that were dealing with horrible alopecia. Like, it was just devastating to see their emotional where they were with just the insecurity of their hair loss. And so this one woman, I actually referred her to you, as a matter of fact, but an African-American woman that had gone to someone in Atlanta, Georgia, and they had terrible bedside manners, basically said, yep, this is the way it is. You can prevent more from more loss, but you can't do anything about it. It's just the way it is. And she just started crying. I was crying with her. Like, it was a very emotional experience. And she just doesn't feel like she's showing up in life as she wants to be. So let's talk about that, because my audience is mainly women. And when you think about hair loss, and I mean, men get, a little maybe insecure with it as well. Not all, but some do. But women especially have that insecurity. Let's talk a little bit about the emotional part and how you can help alleviate just the emotional aspects of
Sure.
hair loss.
Well, hair is a very emotional organ, as we
Mhm.
say here in the practice at Bauman Medical. And that's why we have boxes of tissues inside the consultation rooms, because sometimes it can be very disturbing to the person who's losing their hair, a man or a woman. And, it can really affect their quality of life, because hair is a sign of vitality. It's a sign of youth. And evolutionarily, we're just programmed with our lizard brain to just, automatically assess someone based on their hair and their skin tone and things like that. And, these are probably protective mechanisms, from evolution before we could maybe communicate with words. Your caveman, cavewoman by the campfire in the cave, and you need to make a snap decision of whether you're going to be able to propagate the species or not. And so hair is an important sign of youth and vitality, and of course, fertility. And of course, today, we know that hair is something that's really, really important for self-confidence. So if you're a man and you're, let's say a man in your 20s and you're starting to lose your hair, you're in the minority and you look much older than your stated age. But it's obvious that you're losing your hair because it's receding or thinning in the crown and so forth. For women with hair loss, it's very different. They can lose their ponytail volume first, or they have a major shedding phase that's happening, or they're noticing a wider part line. Usually those things are happening in the frontal area diffusely at first, and then later on, as the hair loss progresses, it can also recede the hairline slightly. But regardless, for women, think of the crowning glory. This is, you're supposed to have a beautiful, thick, full head of hair. This is how we've been socialized. And so when it starts to fade, whether it be texture, volume, color, coverage, you name it, it can be disconcerting. And especially if it's happening quickly. So that's the time to take action at the earliest possible time.
Yeah, that's good. And I think, there's there's obviously multiple reasons why hair loss occurs. So let's dive into that, because some people lose hair during puberty. Some people, of course, I remember when I was pregnant with my son, and after I had him, I had lots of hair that went away, and I was crying as it was just pulling out. And I'm used to having nice hair, but luckily it regrew. But also menopause and that kind of thing, which is typically my audience, the age range is perimenopause and menopause. So let's talk a little bit about the reasons why and the hormonal disconnect.
Absolutely. So at Bauman Medical, we treat all types of hair loss. So it could be autoimmune or genetic hair loss. It could be influenced, as you say, by hormone imbalance or changes in your hormone status through childbirth or menopause or PCOS and years of childbearing age. For men, it's primarily genetic and it clicks along due to time exposure to the body's hormones. But everything from whole body inflammation to scalp health to your overall nutrition, your sleep wake cycles, your stress and cortisol levels, the allostatic load, as we say, which is everything that stresses out your body, can influence your hair follicle function. And you
Yes.
stack on top of that medications like antidepressants, anti-anxiety agents, cholesterol meds, blood pressure medications, weight loss medications, and peptides. All of these different things can affect your hair follicle function. So it's our job as clinicians to kind of dissect through all of that. First, looking at your genetics, really, open up that family album and let's see who's got some hair thinning out there. Male pattern and female pattern hair loss is the most common thing that we treat. But as I said, there's many other factors that can influence the rate of loss that occurs in that genetic tendency.
I'm so glad you brought that up, because that's one of the reasons you are more of a holistic doctor in the way that you are, because you're looking at the whole person. You're not just saying, okay, let's just go in and do a hair treatment. You want to get to the bottom of why things are happening, and for them to, for your patient to actually reverse what they're doing, whether it's the nutrition, whether it's, the meds that they're taking, or really have an understanding, right?
Yeah, well, in
So
the hair world, we own the word root cause.
there you go. Good. Da-da-da. I feel like, where's the drum roll? Yeah, you're right. Root cause. Absolutely. It is. You get to the root cause, because I actually, I remember some girlfriends that back in the day, they were hairdressers, and they always said, oh my goodness, we can always tell if someone's on a certain medication, if their nutrition is bad, whenever we're doing our hair, just the way it feels and how it's falling out, or the lackluster kind of way in which the hair is. So you can tell a lot about a person through their hair follicle. How many genes are responsible for hair growth, hair loss?
Yeah, genes or SNPs, single nucleotide polymorphisms, there's probably hundreds of different gene locations that are responsible for hair loss, as well as the hair color, quality, texture, and different metabolic pathways. So it's interesting that you asked that, because we often do a genetic test to see what treatments might work best for that particular patient. Now, of course, we're taking all the other history data points, their examination data points, their hair density measurements, their hair caliber measurements in several different areas of the scalp. We're compiling all that information, as well as all the different things that we talked about before: exposures to toxins, their styling habits, exposure to tension or tightness or braids, even if they've
Yeah.
worn hair extensions or wigs or weaves and so forth.
Hats.
Hats, well, hats are, I mean, the hat has to be pretty medieval if it's going to really
Was that
hurt your
right? So
hair.
not just
Yeah.
wearing like ball caps all the time and cowboy hats. Okay.
No, that's not. When we say hats cause hair loss, really it's just usually because of the delay. So young men will gravitate towards a baseball hat to cover their hair loss because it reframes the face. It makes
Sure.
them look more youthful and younger. And then they ignore the hair loss. They don't go out without the hat. And every month and week or year that goes by without treatment, their hair loss gets worse. Then they take off the hat next year. Oh my God, of course the hair loss is going to be worse, but it's not because of the hat. It's just because of the time. And, we also say in hair that time equals follicles because of that issue. Hair
Hmm.
loss doesn't get better on its own without treatment.
Yeah, that's so good. So, when you are addressing the whole person and you find someone that comes in and they're not willing to change their diet, they're not willing to adjust any medications, or change their sleep pattern, or do any of the modalities that can really help to heal the body, do you still treat them? Are is there? I mean, maybe that's a loaded question, but I just wonder because sometimes people just want a quick fix. I wouldn't say sometimes. I would say most of the time, people want a quick fix, and they don't necessarily want to do what will reverse what's caused the issue to begin with.
Well, I'll give you a great and simple example. A lot of men and women think that the hair transplantation is the ultimate cure for the baldness, and they are correct that it is permanent. When we redistribute hair into a thinning or a balding area, those follicles are going to live forever. And so they figure, well, why do I need to do all these other things? Why do I need medications or lasers or regenerative treatments like PRP? Or why do I have to come in for microneedling or scalp health and all that? But really, it's our job as clinicians to really educate the patient about these factors that could be used, the medications or treatments or other interventions to help protect the follicle function of the non-transplanted hairs. And so I think once they understand that, I mean, maybe I'm blessed with a well-educated clientele, but once they understand that there's like that two-pronged approach, there's that preventative aspect and then the restorative aspect at the same time, then they understand that this is a long-term battle and that it requires a commitment, just like, brain health or muscle health. You want to stay flexible. You want to stay sharp in your mind. It's going to take some effort on your part to do that. And, look, if you're blessed with a lean muscular physique, maybe you don't have to work out as much or as hard as everybody else. But if you're like the rest of us, we got to hit the gym and watch what we eat. And so the same is true for most people with hair. There needs to be some guidance. And I think once you elucidate that, once you bring that to the surface and shine a light on it, our patients understand, okay, now I know what's affecting my hair. And hair, they're coming in already. They paid for a consultation. They're spending the time. They're getting their measurements. They're already motivated to find the solution. And so it's just my job to educate them as to, look, these are the things that are impacting your hair. And I'll tell them, I would be remiss if I didn't tell you that your night shift job or your weight loss program is not impacting your hair. I mean, even at the time we were dealing with COVID during the pandemic, I mean, the infections that we saw that were severe and the long COVID situations that we saw, it was causing these shedding over time. And so sometimes patients could do something about it. Sometimes they couldn't, but at least they understood what the impact was from COVID and even the vaccinations, which dysregulated immune systems and things like that, and really stirred up a lot of autoimmune conditions in our patients who were in remission from alopecia areata, for example, for a decade. And all of a sudden they came in with reactivation.
I'm glad you brought that up because that was going to be one of the questions. And I'm curious, have you seen still continued people coming in with the repercussions of COVID, long COVID, and the vaccines? Are you still seeing people with symptoms from that?
Well, thank goodness,
Yeah.
Infection with COVID is really not an issue and probably wasn't that much of an issue even early on.
Very true.
But that's my personal opinion for those who
I'm
are
with you on
healthy.
that.
Um, and of course, the prevalence of boosters and vaccinations and such, I think the word is getting out that maybe it's not for everybody.
Right.
And the efficacy, has yet to be elucidated through real, true science. That's a whole nother conversation.
That
But
sure is.
the point is that I think we're seeing a lot less of that. And now, I mean, just to be honest, the trend with Ozempic and other
Yes.
GLP-1 agonists has really overtaken all of that other stuff that we saw during the pandemic. I mean, it wasn't a surprise that someone with a high fever, an infection that could have ended them up in the hospital, for example, would affect their hair. We knew that from the clinical literature back in the 1920s from the Spanish flu. That was the
Yes.
first time post-febrile alopecia appeared in the clinical literature. So hair doctors already knew this was going to happen. We didn't expect it to be like so crazy.
Yeah.
And then, of
Yeah.
course,
No,
the lockdowns and the toxic exposure and the lack of exercise, of poor sleep, and
and
substance
the emotional
abuse,
distress and the abuse,
and
all of that. Yeah.
yeah, the cortisol overload and all of that, created a whole host of conditions that I'm sure you can, all clinicians in all variety of specialties could kind of probably say, hey, everything kind of spiked up, and that's certainly what we saw during the pandemic. But today there's another trend. It's the skinny shot, or
You
the fat
know,
shot, whichever way you want to look at it.
I'm glad you brought that up because yeah, Ozempic is one that I mean, gosh, it's being advertised left and right. It's mind blowing how you look on the television and people are just like, yeah, sure, they say it's safe, and yet your gut microbiome is getting just wrecked, and then obviously it affects everything else, including your hair. And so you're seeing that as well, I'm certain. So let's
Sure.
talk a little bit about what people can do, because there are some natural things that people can do, from nutrition and adding in, making sure they're getting proper minerals because maybe they're deficient, or making sure that they detox because maybe they have toxic overload. There's all these kind of things that you can do to help, but it's not going to be the full solution as far as the regrowth of hair. And that's disappointing as a naturopath. Like, I would love to say that, oh, just, make sure you're eating lots of food with biotin and, all these things, and your hair is just going to flourish. But unfortunately, that's really not the reality. It's going to help, right? And making sure you get enough circulation on your scalp and that kind of thing. But what would you say to someone that is like, I am starting to notice that my hair is thinning. I notice every day that I lose quite a bit of hair, but 100 hairs a day is of shedding is pretty normal. Is that correct?
Yeah, so we could talk about the shedding. Certainly, the signs and symptoms of hair loss. If your hair is long enough, you might notice more excessive shedding. So it is true that hair follicles cycle on and cycle off over the years. And so think of the hair follicle as like a 3D printer. It's going to make that hair strand for a period of time. Now, unless you're genetically blessed, you're not going to grow hair down to your ankles. Now, you can look in the Guinness Book of World Records. I guess there's a website for that now. There's plenty of women that have hair that can drag along the ground, but
Gross.
those are genetic freaks of nature.
Yeah.
The rest of us have a cycle where the follicle will shut off after 5 to 7 years. That gives you basically shoulder length hair or ponytail. And so after that hair follicle shuts down, it degenerates, rests, and then regenerates. And that rebooting process, if you will, takes usually about 90 days. So hair follicles are always, every single day, 150,000 of them on your healthy head of hair. Some of them are turning off, some of them are turning on, and it's about 85-15. So 85% growing, 15% resting, and so forth. So every day, about 100 hairs to 200 hairs shed is actually normal if they're being replaced.
Mhm.
Now, that's a big if, right? So how do you know if your hair is being replaced at the same rate that it's shedding? Well, you've got to measure your hair, or you've noticed that when you put your hair in a ponytail, well, now you've got to string it around 3 times instead of twice. So very often that's a common sign or symptom. So the shed or the lack of volume, right? You mentioned hair texture changes, hair color changes. Of course, those could be indicative of other lifestyle factors and things like that. As we said, childbirth, weight loss, infection,
Stress. Yeah.
stress, all that's going to
Mhm.
be dysregulate your hair. So you got to come in, get measured. So we have
So what do you
different.
do during a measurement? I actually saw this personally when you did this on my husband, but yeah, explain what a measurement consists of.
Yeah, so we have probably about 4 different ways to measure your hair, but just to keep it simple, there's a physical measurement, right, of making a scientific ponytail, like a 2 by 2 centimeter area. That's the size of a postage stamp in different areas of the scalp. And we track those same areas over time. And we also compare the good areas to the typically affected zones so we can see what the percentage of loss may have already occurred. And then when you're on therapy or treatment, we're going to go back to that same area again and again and physically measure the bundle of hair. There's also AI powered microscopes, which literally count the hairs on your head. And
Amazing.
so, there's some, I'm sure you know the Bible verse about all the hairs are counted, right?
Yes, that's
So,
right.
yeah. So, we can literally do that and count
The
it.
real intelligence, not the AI.
Yeah. So yeah, exactly. So we can count all the hairs on your head, and actually we can number them as well, believe it or not. And so
Fascinating.
we can go back to an area of the scalp without even doing a tattoo or any way or any kind of mapping or marking there. The microscope will actually know exactly where we took that previous photo. And it'll say hair number 433 or 722, and it'll tell us whether it's thicker or weaker or missing or gone or whatever. So the number of ways to do that. So not just the hair counts, which are the numbers of hairs that are visible at the level of the scalp, but also the caliber of those hairs. And that's really important because hair follicles don't just turn on and turn off. They actually get weaker with time. They grow shorter, thinner, weaker, wispier hair. So the follicle makes a weaker hair slowly. And that's the time where you want to intervene before the follicle is beyond repair.
Okay. Let me ask you this question. Do you believe that, okay, we have mites on our body, right? So we have mites in our hair. And I'm just asking this question. Do you believe that sometimes these mites aren't, the immune system isn't responding as well to these mites, and then they shut down the hair follicle for some people? Is this a myth or true? Do you know what
Well,
I'm
I
talking
think,
about?
yeah, I know exactly what you're talking about. And these
I,
microorganisms that live
yeah,
on our skin and on our
yes.
pillows and in
Which
our
is
bed
hard to even think
sheets.
about, but it's a
Okay.
reality.
I mean, and you look at them under a microscope or a
Yes,
scanning electron microscope, they look like aliens from outer space.
right.
Unfortunately, some shampoo companies a couple of decades ago used those photos to scare people into buying their shampoo,
Right.
saying that these scalp mites cause hair loss. It's really not the case. Now, could the microbiome of the scalp contribute to inflammation, irritation, and dysregulate the hair follicle? I will say absolutely yes,
Okay.
because we know that there is a delicate balance of microbes. Think of it like bacteria, fungus, and things like that. All the
Like
stuff
your
that's living
gut
smaller than
microbiome.
a mite, right? So a
Hmm.
mite is like a little animal, but I'm talking bacteria that's an order much smaller.
Right.
Same kind of thing that you have in your gut microbiome, which, as you know, is so important to take care of for so many different things for gut health, whole body inflammation, even just mental status and emotional stability,
Sure.
as well as absorption of nutrients. Well, on your scalp, if your, let's say, fungal colonies go way out of whack and get really increased, and there's one specifically called malesthesia, if he gets out of control, you can have dandruff, seborrheic dermatitis, itching, inflammation, irritation, and it's not a good thing, right? So we definitely want to keep an eye on the health of your scalp, because that's the soil in the garden that we have to keep, you know, worthy, if you will, of the hair follicle function. And so if the soil in the garden is no bueno, you're not going to grow good hair. If it's inflamed,
Good.
if there's folliculitis, I mean, this is a very important consideration. And it's so important that I have an entire department geared towards trichology, which is the study of the health of the scalp. And we have therapies and treatments and other modalities that we use to
So
cool
good.
down inflammation and scalp health issues, which are epidemic today.
Yeah, they really are, and a lot of it can stem from nutrition and that kind of thing as well. But I
Absolutely.
wanted to bring that up because I had someone talk to me the other day, and they remembered that commercial that you talked about, and I said, I'm just going to bring it up. Let's just talk about the mites because it's a reality. They're on our body. It's kind of gross to think about it, but they're tiny mites, and just curious if that was a bigger culprit than what maybe we realized. So
Yeah.
anyway,
I,
thanks
I
for sharing.
think that, I think the microbiome of the scalp is really
Yeah.
that story that needs to be told. And years ago, we didn't know that the scalp even had a microbiome. And the research in the dandruff world, right? Like, so large companies like Procter and Gamble did a lot of this research, funded a lot of this research to figure out which are the organisms that really dysregulate the scalp
Yeah.
and the hair follicle function. And if looks, and we always say, if your scalp is itchy, flaky, oily, if it's irritated, if there's some sensation there that's not normal, it's time to listen.
Yeah. Yeah. It's your body speaking. It's time to listen for sure. So what are some things that someone can do just simple
Mhm.
that could start to hopefully restore their hair without having to go straight to surgery? Because I know you're not like a big surgery guy. I mean, you've done a lot of surgeries, like 12,000 hair transplants or more. But what do you typically point people to first? And I'm going to put this on because I know this is one of your answers, but this is something that you offer. And if you're watching on YouTube, I wear this every day for about 5 minutes while I'm on my vibration plate. So that's actually my husband's. And when I found out that I could wear it too, I was so excited. I'm like, well, why not? I'm going to use this. So infrared
So it's
is
actually
important.
visible red. So visible red
It's visible
wavelengths,
red.
low level laser light, or photobiomodulation has been a part of my practice for over 20 years. And I have to tell you that when I went to medical school over 30 years ago, they didn't teach us that red light had an impact on animal cells. When I heard about light affecting cells, I'm thinking
Yes.
photosynthesis, like in a plant.
Ah, yeah.
But today we know, as you have learned as well, that red light is a very, very powerful tool to increase ATP production through the mitochondria. That's where
Stop
the red light gets
inflammation.
absorbed. ATP is the energy currency in the cell. And think about this, hair follicles are highly metabolic. They need a lot of energy to do their business. And so if you provide them more energy, you're going to get better quality hair growth. So that's why we always recommend something non-chemical, non-invasive that has zero side effects, like red light therapy. And that's the Bauman Turbo Laser Cap that you just showed everybody. And, that is not your Amazon version,
No,
okay? Some LED, couple $100 device
that's
that's
not
going to
going to
take you
work.
a half an hour. So this is a 5-minute device. And I just want people to understand that lasers are different than LEDs. Lasers have higher power density. They're going to give you a much better delivery of laser light energy to the scalp to increase blood flow, decrease inflammation, and promote hair growth. This is a hair growth laser. So I want to be clear that it's FDA cleared for hair regrowth and just 5 minutes a day. And as you saw when you put it on, it covers all the way from the hairline and the temples way back into the donor zone or occipital zone down to the nape of the neck. So if you're a woman and you're wearing extensions back there, this is the only device on the planet that treats that area.
Good. That's good. And so, what have you noticed with the turbo laser cap as far as with the counting every hair on the head, as far as how quickly regrowth has happened, or the strength of the follicle, the strength of the hair? How long has it taken for this modality to assist?
Right. So just like with any non-invasive treatment, so anything that's not a hair transplant, we're always going to be talking about, and this includes medications, nutritionals, laser light, PRP, microneedling, other therapies that you might be doing, peptides, you name it. What we're always talking about in that regard is the existing follicles, either first of all being protected from loss,
Yeah,
right? So the genetically susceptible follicles are protected, or the weaker follicles that are being affected are being rejuvenated. And it's not an overnight bit of business because hair follicles grow hair at about a rate of quarter to a half inch a month or a third of a millimeter a day. Think about, a 5 o'clock shadow on a man's beard, or, you've got to shave your legs or where other areas at a certain frequency, right?
yeah,
That's the rate of hair growth. It's not fast. So laser therapy or other treatments that are non-invasive, anything in the hair homework category, which laser is included in, it takes several months for us to start to measure improvements. So 3 months minimum, we're bringing you back to do a measurement, but it could take 6 to even 12 months to see the changes or feel the changes, looking in the mirror or that ponytail volume increasing. It could even take longer than a year.
sure. And
So
what
it's not an
about
overnight cure.
yeah, right. And that's for any modality regarding the hair, quite frankly, right? So regarding PRP, platelet rich
Rich.
therapy.
Mhm.
So let's talk a little bit about that and how you have seen results using PRP.
Yeah, so we've been doing PRP in the practice for 20 years. We've done over 14,000 regenerative treatments using PRP and other things. PRP has changed a lot. And so this is not your Medi Spa. This is not your cosmetic dermatology PRP process in a little tiny test tube with a gel separator. This is a very sophisticated protocol in a closed system, dual spin to create the accurate amount of platelets to deliver the hair growth effect. And this is something that's missed by many folks,
Yeah,
unfortunately, in the world of cosmetic dermatology and med spas. They think that the same Kim Kardashian facial treatment is going to give you hair growth on the scalp. And it might do a little bit, but it's certainly not going to be that powerful. So we've learned how to fine tune the PRP, a number of different things that we do to the PRP. Like I said, the correct number of platelets, preserving the monocyte or red, white blood cell population, treating that PRP with photobiomodulation using certain frequencies and wavelengths of light, how we deploy it into the scalp, the correct depth, how to
mm,
keep the patient completely pain free while we're doing it. Like making the scalp completely numb is something that many dermatologists either forgot or didn't learn how to do. So if you've had a lot of people have had PRP, they say it's painful and it didn't work. Yeah,
mm,
well, hair transplants used to be pluggy and painful too, but we fixed that 20 years ago. So, PRP has changed as well. It's not the only thing that's available, but PRP is a very powerful modality. And in my practice, it's not a series once a month forever. No, this is once a year, and you're going to get a powerful effect on the hair growth. And we've proven it time and time again. We have all of our research, and we measure all of our patients. So, as I said, I've always treated over 30,000 patients. So we have a lot
Yeah.
of data that shows that our protocol, 90% of the time, is going to give you a boost for 10 to 14 months.
Okay, that's incredible. And also, you use a lot of peptides. So you kind of do some stacking with your protocols, right? So let's talk a little bit about peptides, and then we'll kind of talk about the stacking. And I know every case is different, but let's talk peptides first.
Yeah. So I'm excited about peptides. I mean, it's a whole new world of non-pharmaceutical treatments, essentially. Many of them if you're going to inject them, many of those have to be provided by a pharmacy. But topical peptides can be over the counter or off the shelf, I should say. And so probably the most powerful peptide we use is copper peptide. But there are several other ones. There's zinthymolin, there's a thymosin beta 4 with TB500 derivative. There's some other ones, methylvalinate and so forth. We can also push the peptides, not just in a topical that you can use at home. There's an AM and PM version of that, but we can also use sonophoresis, which is an ultrasound device to push the peptides through the skin in the office. And that's called TED, transepidermal delivery of peptides and growth factors.
Through sound and light. I mean, are you hearing this? Like, this sounds like, it's powerful. Like knowing every number on our head, sound, light, creation. I mean, I could preach on that. That sounds good. But I think about just how this is just a whole other world from when you started in the 90s, right? Like
Oh my
it's
God.
powerful, and you're giving people their confidence back, their life back. But what are the side effects? I think that's the big question that a lot of people have. I mean, most people think of like Rogaine,
Mm.
that kind of treatment. And so let's talk about the side effects from something like that, and then
Sure.
also side effects from even the peptides route.
Right. So Rogaine is the OG, right? The
Yeah.
original. Okay. It was the first FDA approved drug. It was a topical medication. It's still available today, any supermarket and so forth. But the problem with the Rogaine, well, first of all, it contains minoxidil, which is a powerful hair growth treatment. But the problem with over the counter or even cloud pharmacy versions is that minoxidil is dissolved in something that's very irritating for a huge number of users. And usually the minoxidil that you could get over the counter is minoxidil plus propylene glycol. And propylene glycol is just nasty. It's greasy, it's gooey, it's irritating. So very often patients will say, "Oh, I tried Rogaine. It was nasty, greasy, gooey. And then also I had this raging inflammation on the scalp. It was itchy, it was terrible and flaky, so I had to stop it." So that's no good. Prescription versions of minoxidil, like 82M, that's a formula 82M, and there's other ones as well, but formula 82M is the most popular one in my practice, doesn't have any propylene glycol in it. So if you want to use a topical that's a prescription, you have to go with a compounded version. And we throw a couple of other things in there. There's a little bit of fluocinolone for anti-inflammatory. It has tretinoin, which is a retinoic acid, which basically increases the penetration. And that makes the minoxidil, the formula 82M, first of all, much easier to use. So it dries quickly, not irritating to the skin, and very powerful on the hair follicle. So that's a
That's what we
pretty
want.
basic thing. Now you might be thinking to yourself, "Oh, I don't want to slather that stuff into my head twice a day. I got to coif my hair. It looks so beautiful. I don't want to do it. I don't want it to damage my hairstyle." Okay, I've got another solution for you. You can use minoxidil in the oral version. So we can compound an oral minoxidil at a micro dose to avoid any kind of side effects. And that can be a very powerful game changer for both men and women, actually,
Okay.
out there.
That's good to know.
Um,
And I would
uh,
imagine a lot of people would go that route.
yeah, I'm not familiar with any side effects of peptides, to be honest. So we
Okay.
feel very comfortable using those peptides. Obviously, if you're allergic to one of the ingredients, that's a different story. But I've never seen a side effect or skin irritation from our peptide combination. It's called Pep Grow. There's an
Okay.
AM and PM, PEP, Pep Grow, GRO. But that's a very, very popular item, especially if folks want to avoid the pharmaceuticals. They'll combine lasers and Pep Grow typically. So the Bauman Turbo and the Pep Grow, put that together. That's a great hair homework stack, if you will.
I love it. I love it. Okay, good. Now let's talk a little bit. You mentioned AI earlier as far as being able to count the numbers of hairs on your head. How else are you using AI in your practice right now? And where do you see this technology taking hair restoration?
Yeah. So if you came into my office, you would notice that there are mirrors, which are touchscreen devices in the waiting room, in the
I
lobby
saw
area,
that.
and also in every single consultation area, as well as our surgical waiting rooms. So what happens is that you can actually go up to that mirror, and if you click the correct button, you can ask Dr. Bauman a question. Well, guess
You've
what? It's not
cloned yourself, is
yeah,
what you've done.
it's not me. It's a virtual avatar, and we call it Ask My Avatar. And it's something that's been really exciting to be able to bring to fruition. Something we've been working on for over a year, probably 2 years now. And it's trained. It's an LLM, which is the background of what you train a AI powered chatbot on, essentially. And it's been trained on all the information I've ever written on my website, literally 25,000 pages for over 25 years. And it's comported that information, and it looks like me. So it kind of has a similar uh, body type, and it sounds like me, I think, a little bit. Now I'm getting used to it, but you can interact with it. You can ask it questions about hair loss and hair restoration, and it will give you answers based on that training. And so it still can't do surgery because it doesn't have arms, but if you want information on any of the products, services, and treatments that we have, you can interact in the office. Now, I'm working on one that's going to be deployed on the website, but I want to make sure that it's very accurate, and also that it doesn't get me into trouble, and also that there's all the security factors around it, so it can't be duplicated and be out there doing its own thing on the internet.
Yeah, right,
So
right. Well,
um
well, Todd and I witnessed that, and we asked your AI guy
yeah.
lots of questions, and it was really cool. So I did. I wondered how you were going to start using that for your patients that live elsewhere, like us, to kind of do the entrance process of onboarding and that kind of thing, and really get to find out if this is a good partnership and patient for you. So I think that will help a lot.
Yeah.
Regarding your the other things that you do in life, I know you're very active and you have an incredible family, but you're also very philanthropic. And you, gosh, you have a nonprofit, but you also have another component to your heart, and it's called the grayteam.org, I believe, right? And
Yes,
this is
correct.
something that you got involved in. And you mentioned this when we were in your office, and I'm like, what in the world? Tell me more about this. So let's talk a little bit about Gray Team and what you were doing in that space, and also your other philanthropic reaches.
Yes. So Great Team helps take care of active military and military veterans. And while I never served myself, my grandfather did in the Navy, and so did my uncle. And so to honor them, I really got involved with Great Team to help prevent PTSD related suicide in our active military and military veterans. And I'm super proud at what Great Team has been able to accomplish in a relatively short period of time. It's a pretty new endeavor. I would say it was born about 8 or 10 years ago. And now we've treated about 1,000 military veterans, and we treat them for free. They can come through the physical facility, which is located here in Boca Raton. It was founded by my good friend Carrie Reichbach, who is an ex Army guy, and he's amazing. And there's also another component where we do nutritional guidance and one-on-one personal training. It's essentially a 90-day program, although it's a little bit flexible. Any veteran, any active military who's in the area can apply. Once they're accepted, they can enter the program, and there's never a charge. So it's 100% free for all military folks. And what's exciting about Gray Team is that it's not just nutrition and fitness, which I think handles a lot of the main issues that we see when these guys come back from
With the
military
mental health.
service.
Yeah,
Yeah.
yeah.
But also, we have a lot of very cool, cutting edge, non medical technology, non pharmaceutical technology, like far infrared sauna for detoxification, hyperbaric oxygen for traumatic brain injury. We've
Yes.
got pulsed electromagnetic field for inflammation and pain. So we have all of these different tools. We even do EEGs for the brain scans. And then we have helmets that are from Germany. Dr. Weber created these helmets that can transfer light energy, those are the near infrared and far
Yes.
infrared technologies, to increase blood flow in the cold spots of the brain, so that we can improve brain function in many of these military veterans. And it's just been amazing to see their lives changed and transformed.
That is so
So,
powerful.
so
And I would
we
love
do.
for you to share. I'm sorry. I would love for you to share a story of someone, because I know you have a story because you shared that in your office, of a gentleman that you worked with that was kind of near and dear to your heart.
Yeah. So, well, gosh, there's so many that
So
come to
many,
mind, but
but
one in particular, I remember he came to Gray Team, and he was so weak. He's in his 80s, and he served in Vietnam, and he was basically like a poster child for Agent Orange, the toxic exposure and so forth. He had so many ailments. He really was becoming debilitated. He was becoming off balance and weak. He could barely open the door to Gray
wow.
Team, and we put him in the program with the fitness and the nutritional modifications and those therapies that I mentioned to you for detoxification and for pain control and all of that. I remember his graduation day so vividly, after the 90-day program. He said in the beginning, all he wanted to do was to run a 5K. I'm thinking this guy couldn't even open the door, and he
Wow.
couldn't even walk up the stairs. And then on his graduation day, he revealed to everybody who was there that the elevator in his condo had failed, and for like a week he had to go up and down a flight of stairs, a fourth floor, and he did like 40 or 50 flights of stairs on his own with no issues or problems whatsoever.
At age
So
80, that's
he's
freedom.
yeah, he's an amazing guy, and you can see his testimonial at greatteam.org, as well as many of the others. But there's just so many, from young to old, in the middle, you name it, men
I
and
love
women,
that.
whose lives were changing for the better with Great Teams. So I'm just going to plug the America First Gala. If you want to go to Mar-a-Lago in December and party at the
Yes.
president's house, then please join us for a great cause. America First Gala is nonpartisan. It's exclusively for Gray Team to raise funds to help us expand our reach to these military veterans and active military who need our help so badly. And we also have an event in the spring at the Boca Raton Hotel and Club every year. So those are the two big events. That one's called They Are Not Bulletproof. So if you go to americafirst.com, America First Gala, I'm sorry, americafirstgala.com, or theyarenotbulletproof.com. You'll see both of those fundraising galas. And of course, grayteam.org is the place if you want to get involved. And so I encourage everyone is in earshot to take a look and see what kind of good work the team has been doing.
I love that. And I love your heart behind it and just your passion. And when I heard what all you guys are doing, I just was like, oh my gosh, we have to talk about this. And so we'll put that in the show notes as well.
Awesome.
And also, some of those modalities are being used for cancer patients as well. So there's a lot of great ways that people can be helped by the hyperbaric chambers and that kind of thing that you're using in the infrared saunas.
Absolutely. Absolutely.
So, well, I
And more
appreciate you.
importantly than all of
Yeah.
that, I think Great
Yes.
Team, it's this social network. It's like the camaraderie. So yeah, we've
Yeah.
got hundreds of thousands of dollars, millions of dollars worth of equipment that's been donated by the health and wellness industry. All of that has been 100% donated. But there's also a
Wow.
pool table, you know,
Yeah.
and a couch,
They have
and
community.
that goes a long way as well. So it's not just high tech, but it's also high touch, and providing that for these folks who sometimes have been neglected through those years where the military veterans were maybe not treated as well as they should have been. Um, it's really a pleasure and an honor to be involved.
Wow. That's so beautiful. And then your other philanthropic nonprofit, what are you typically doing
Yeah,
through that one?
so Bauman Philanthropic Foundation was started many years ago. My wife and I, my wife Karen is an educator, so we support educational programs that are here in South Florida, but we also do pro bono hair restoration treatments and procedures. So if
Okay.
someone, we've had folks come in who have been in car accidents where they had a loss of their eyebrow or eyelashes. We've done those restorations.
Wait, hold
In
up. Eyelashes? You do
Yes,
eyelashes and eyebrow restoration?
yes.
Okay, that's good to know too.
Yeah, I probably do more eyelash transplants than any other surgeon in this part of the world. It's been a part of my practice since the 1990s. It's a very fun procedure to do. Comes with scissors. You have to trim them. But
Wow. I think
It's a great
that would
procedure
be
to
a kind of
perform.
a hot surgery right now with everyone getting the lashes
The
extensions.
extensions and the
Yep,
latisse and
yep.
all that. Yeah. So,
So
but when the lashes are missing,
yeah,
dust and debris get into the eye. So there's a really
right.
important form and function as well. So the function is to keep the dust and debris out, and of course, the
Yeah,
form is the beauty of the eye, right? So we've also done restorations for some of the military veterans who have come back from the
going to
combat
ask you that.
theater with devastating burns on their scalp. I remember one who was in a helicopter crash that had burns throughout his entire scalp. Luckily, he had enough hair for transplantation to fill those areas in. And we've done other things, young boys with birth defects, in their teenage years, and they've got, a big spot that looks like a scar, and we fix that for them. So, there's quite a number
Wow.
of things that we've done over the years through the Bauman Philanthropic Foundation. Um, and, my family is happy to support those pro bono cases that we do, and anything related to education of our youth.
Yeah.
That's really truly my wife and I's passion. So Karen and I are super happy to be, providing that to the local community.
Well, I love all that you guys are doing, and I appreciate you, and I appreciate your heart and your compassion and the way that you are really helping people get their lives back. And I don't know that many people really think of that when they think of hair, but it really is getting people back into a place of feeling confident and showing up in the way that God wanted them to show up to begin with great confidence and fulfilling their calling and purpose instead of shrinking back, right? So,
Absolutely,
yeah,
absolutely. There's nothing more rewarding for me than to see those patients who have had their confidence restored and just see their eyes and their smile light up when they see the before and the after results of our procedures and treatments. That's the life-changing stuff that is the lifeblood of the practice, and it's the reason why we show up every day. My team and I have 30 team members now, and we show up every single day to help make those changes in people's lives. And it's
that's so
great. It's a
good.
bless. It's truly a blessing.
Right, it is. And it doesn't matter how young you are or how old you are working with all age ranges and male, female. And if you guys are interested, go to baumanmedical.com. You're going to learn more about Dr. Bauman and his team, and go out and see him in Boca. Get a consult, get educated, and find out how your life can be changed by doing the modalities that they offer for you. So anyway, thank you for your time. I appreciate you, Alan, so much. And thank you for
Thank
all
you,
you do.
Wendie, for having me on. And don't forget, they can also connect with me virtually and also in my satellite office in New York. And sometimes we pop up in Indianapolis too and other places around
Excellent.
the
All
country.
right. Come see us in Minneapolis. All right. Take care. Bye bye.
Bye bye. Thank you so much for having me.
Well, thank you so much for tuning into this episode of the Visibly Fit podcast. I hope you enjoyed that conversation with Dr. Alan J. Bauman. He is such a remarkable human being, and I love what he is doing in his practice. And definitely go to baumanmedical.com to learn more. I'll put that and his other philanthropic sites on the show notes or in the show notes so you can find those. But if you are just even curious, go and check it out. Maybe you're thinking, my hair's thinning just a little bit, but it's never too soon to go and check it out, right? And to solve the problem early so you're not having to deal with the agony of hair loss for so many years. So again, my husband and I, we were there last year, and he's been treating my husband. I think my husband has great hair, but you know what? It's based on your own feelings and thoughts about your hair. My husband's like, oh my gosh, I used to have all this thick, wonderful hair. And I think, like I said, I think he still looks great and has great hair, but to him, his hair isn't like it used to be. So he's doing a few of the modalities, and it's helping as well. And hey, I'm getting to benefit by using the turbo laser cap myself. So there you go. Anyway, go check out baumanmedical.com. And as you know, if you are curious about your own health and wellness protocol, like you're looking for someone to take you by the hand and get you into a healthier place, mind, body, spirit, emotions, then go to wendiepett.com to learn more, or go to getvisiblyfit.com. And that's where the actual 7-week protocol that I offer resides, on that website. But if you have questions, just email me and we can set up a call to discuss and see if it's a good fit for you. All right. Thanks so much for tuning in, and share this episode with others. God bless, and we will catch you next time. Same place, right here on Visibly Fit. Take care. Well, that's a wrap for today's show. So thank you so much for tuning in. I love spending this time with you. To learn more and get more free resources, just head on over to wendiepett.com. And thank you in advance for sharing this episode and this podcast, following and subscribing, not only to this podcast, but finding me on social media, Instagram, YouTube, Facebook, wherever you are, I'm probably there too. Until next week and our next podcast time together, make it a Visibly Fit day.